Did you know that approximately 1.25 million Americans are diagnosed with type 1 diabetes? About 193,000 Americans under the age of 20 are estimated to have been diagnosed with diabetes. Today, we'll be talking with Justine, a 13-year-old girl who was brave enough to share her experience and her story with us.
Hi, my name is Justine Diabetes colitis I, and I was diagnosed with type 1 diabetes mellitus. And I would like to share my story on how diabetes has affected my life. I'm 13 years old and I've been pretty active in my life playing sports like volleyball. But lately I've been feeling less active and have had thoughts of quitting the volleyball team. Ever since I was diagnosed, I've been feeling weak and have realized I get tired more quickly.
Is this still rolling?
Yeah.
Gotcha.
Justine has always loved sports as she is usually very active, but lately she is seen without energy, and she's been eating and drinking a lot in one sitting. What scared me the most about Justine was, despite the fact that she's been eating and drinking a lot, she's been losing a lot of weight as well as visiting the restroom more frequently. These are the same signs that I noticed in her brother when I took him to the doctors.
I was diagnosed with diabetes when I was 10 years old, and I've been living with it for about 7 years now. And being that I've gone through it for a few years now and seeing what my sister's going through, just being there for her emotionally, giving her some support and anything that she needs to know about, living with diabetes and, treatments or anything, I'm just happy to be there for her and to help her out.
After feeling like this for a while, my mom decided to take me to the doctors and meet with Dr. Fong.
I can't disclose any information about my patients, but I can assure you that everything she is explaining about her condition is correct.
I completely understand where you're coming from, but would it be possible for you to share some knowledge about diabetes, and specifically type 1?
Of course, I'd be happy to. Basically, diabetes mellitus type 1 happens when the immune system attacks cells in the pancreas known as beta cells, the cells that make insulin. That's the main difference between type 1 and type 2 diabetes. Type 1 can't produce insulin. Insulin is a hormone that helps move sugar or glucose into the body's tissues. Damage to the beta cells from type 1 diabetes disorients the process. With the absence of insulin, glucose cannot be moved into the cells, and as a result, glucose builds up in the blood and the cells essentially starve.
What are some symptoms that someone with diabetes mellitus type 1 may experience?
Symptoms may include heavy thirst, increased hunger, nausea and vomiting, frequent urination, unexplained weight loss, and fatigue.
So what have you been doing to treat your condition?
After meeting with the doctor, I met with a nurse that explained my prescriptions and gave me tips on how to maintain normal blood sugar levels.
So one of the main treatments for type 1 diabetes mellitus is insulin injections. Most insulin comes in vials, which is drawn out with a syringe, then injected into the body. As Dr. Fong stated, insulin helps the body to move glucose into the cells. All people with type 1 diabetes mellitus use insulin to control their blood sugar levels. Another important factor towards maintaining low blood sugar is exercise and just staying active.
Before I got treatment and when I didn't know too much about diabetes, I did not want to do anything. But now with the treatment I'm getting and the support that my family gives me, I can continue to play volleyball and enjoy time with my family.
Diabetes is clearly a serious condition, but with the right treatment and support, you can be just like Justine and not let it dictate the way you live your life. Diabetes sucks. It is often hard to face, but it's not the end.